Good day, my name is Nicole Rigaspi Sasaluya. Today I am going to perform the female urethral urinary catheterizations. So catheterization is a process in which the catheter is inserted to the urethra to collect or drain the urine. So first thing to do is to check the physician's order for the catheterization. And of course, we need to introduce ourselves to the clients and verify the client's identity. Establish good rapport to the client and provide the client opportunity to ask or raise for her concerns. I already performed hand washing to prevent the transmission of microorganisms, but today I am going to perform hand hygiene for safety. So I already provide for the client's comfort and privacy by screening and closing the room. So these are the equipments needed. So we have the set of catheter. So it contains with the catheter set. So I improvised the catheter. So let's assume that this is the catheter and the catheter bag. And we have 2 sterile gloves, a waterproof pad, clean gloves, forceps, basin, cleansing cotton, lubricant, and syringe. Next, I am going to introduce ourselves to the patients and verify the client's identity. So, good day, ma'am. My name is Nicole Rigaspi Sasaluya. I am going to be your student nurse for today. Ma'am, may you please verify your identity? Kindly state your surname, name and middle name, and also your age and birthday. Okay, thank you, ma'am. So, okay, today, ma'am, the procedure that I would be doing is that I am going to perform the urinary catheterization. So this order is based on the physician's order. So this will help you to relieve your acute urinary detention. So ma'am, I am going to touch you some of your body. Is that okay with you? Okay, ma'am. So ma'am, I am going to start procedure. Okay. So next procedure we are going to do is we are now perform for the perineal care. So we need to drape the patient, and then we are going to put the waterproof pad, and after that we are going to wear the sterile gloves. Next, we need the equipment. So, for the performing a perineal care, we need the betadine with alcohol. So, let's assume that this is a cotton balls with betadine. So, we are now going to perform the C7. Remember that this is 1 stroke at a time. 1 stroke, and then discard. 1 stroke, discard. 1 stroke, discard. Next, we need to remove our sterile gloves because it is now contaminated. And then, we need to discard it. Next, we need to wear a new sterile gloves So now let's lubricate the catheter about 1 and 1.5 inches, being careful not to plug the eye of the catheter. The purpose of the lubricant is to reduce the frictions. So this is our catheter. This is our improvised catheter. Next is we need to lubricate it. So now, hold the catheter at least on 3 inches from the tip of the thumb. So, place the thumb of the finger of the left or right hand between the labia minora. Then separate and pull up gently, because separating the area surrounding the mucus helps make it visible. So now let's insert the catheter in the mucus for about 2 to 3 inches until the urine begins to flow. So female urethra is approximately 1.5 or 2.5 inches. So now I am going to insert. Ma'am, hingang malalim po. So, kapag may nakuha na tayong specimen, we are now going to put in a specimen container. Then now, we are going to connect it with the urine bag. So, this is our improvised urine bag. So now I already connect the catheter and the urine bag. So now, next, let's inflate the balloon at least 10 to 15 cc sterile water using 15 to 20 cc syringe. Then secure the indwelling catheter by taping it to the patient type. So let's assume that this is a 20 cc syringe and this is the sterile water. Next is we need to tape it into the patient type. So next is we are going to put the urine bag into the side bed of the patients, and we need to itali natin to para ma-secure. So now let's remove our sterile gloves. And then discard all the used equipment. And then last, we are going to document the catheter procedure, including the catheter size and the results.